African spouse. Slide, please. Slide. Okay. This presentation will focus on the introduction, methodology, result, discussion, and finally the conclusion. Slide, please. Slide. About the introduction, slide. The literature in infertility reports that worldwide, the WHO estimates that 48 million couples and 186 million people are affected by infertility. In Africa, Nguekeu reports that the prevalence is very high and varies from 15 to 20% in certain areas. In Cameroon, for example, 20 to 30 of couples are concerned, emphasize Nana et al. Slide. Slide. Where am I? The child place is preponderant. In Africa, the child is a central pillar of marital stability. Those authors say that one is not really dead in Africa when he has less descendants. Those giving birth to a child is not only the proof of male virility, but also the continuity of the lineage. For Africans, male infertility is really a taboo, and the main causes of infertility are persecution by evil spirits, cause and non-observance of traditional ritual. The solutions provided in case of male infertility can be observation of traditional rites and ritual, prayers, or medical care. Slide. Slide. The spermogram examination reveals that the male infertility, which was culturally denied, For the couple that have accepted the assisted reproductive technique, it is still very expensive for an African on many levels. It can be financial, sociocultural, and personal. It should be noted that out of 5 million children born of assisted reproductive technology, only 1% are African. The law on the assisted reproductive technology has been recently adopted in Africa. Slide. Great suffering has been noted in infertile couples. Among other, anxiety, depressive states, feelings of guilt, and even shame, etc. It has been found that some give up, others resign and complete treatment despite financial hardship. Some spouses remain undecided about the artificial insemination proposal. Slide. The problem is in this research is at the level of the therapeutic itinerary of assisted reproductive technology, and more precisely the use of the artificial insemination of donor technique in the infertile African spouse. Knowing that the literature on the issue highlights the importance of the cultural value to which an individual belongs in the structuring of his psyche and the meaning of his suffering in his therapeutic itinerary. The research question is that how does slide please? Slide. The research question is, how does the suffering of the infertile African spouse affect his assisted reproductive technology / artificial insemination with donor itinerary? Slide. The objective is to understand the experience of the infertile African spouse in his ART/AID itinerary, taking into account his marital suffering in a context still marked by cultural requirements. Slide. The research hypothesis is as follows. The suffering of the infertile African spouse, apprehended culturally, disturbs his therapeutic itinerary of his assisted reproductive technology process. The formulation of this hypothesis was guided by source theory 1977. Slide. According to this author, the suffering that individuals develop takes on meaning in the socio-cultural context to which they belong, and the treatments are based on this cultural sense of the pathology. Slide. Let's go to the methodology to say that the case study method has been used to allow an in-depth study of individual cases. 3 infertile men aged 37 to 44 were selected by the reason choice technical sampling according to the inclusion criteria. Data were collected from the hospital anxiety depression scale and the semi-structured interview. The hospital anxiety depression scale makes it possible to identify anxiodepressive symptoms on participants. The semi-directive interview was used to collect the data with the interview guide. The information was analyzed using the content analysis technique. Slide, please. Let's go to the result. The result of the hospital anxiety depression scale showed that the average of the participant is greater than or equal to 11. It can thus be concluded that these participants all present symptoms of anxiety or depression. The participant will be in the phase of depression as presented by Kubler-Ross. This positive diagnosis could be explained by the absence of psychological care in the medical care protocol. In this phase, there is the possibility to acceptance and continuation of the procedure. Slide. The result showed that the suffering of the infertile spouse as a result of cultural constraints disrupts his use of AID, artificial insemination with donor. This can be understood in the speech of Mr. C when he says, "Your brother's child, you know it is your blood, but what we take from the hospital is not the blood of the family. What is it? What am I going to tell my ancestors? I will have deceived everyone and myself." What follows is the suffering of the infertile spouse resulting from the fear that the secret maintained by the culture will be discovered, disrupt his use of artificial insemination with donor. Also find his meaning when Mr. S says, "You can do that," talking about the artificial insemination with donor. One day, when there are problems, she, talking about his wife, tells everyone, "If people are aware, what kind of father will I be? What am I going to tell my family?" Slide. Another point is that the suffering of the infertile spouse resulting from the shame of the way others look at him in society disrupts his assisted reproductive technology / artificial insemination with donor itinerary. This is also justified in the speech of Mr. F when he said, "It is difficult to hear that a man cannot manage to have children. This situation makes me really uncomfortable. I wonder what people think about me." The last point is that the suffering of the infertile spouse resulting from the belief in mystical religious persecution disturb his assisted reproductive technology itinerary, corroborate with this sentence of Mr. A when he explained, "In our culture, it is sometimes said that some people also makes it impossible for you to give birth." Slide. Let's go to the result in discussion. Nevertheless, the results of this research corroborate those of work of Tekman and Yaounde, who highlighted the experience of male infertility facing the assisted reproductive technology procedure. Similarly, some aspects of Dorif Varembon and Rosenblum research results have highlighted that assisted artificial insemination with donor involves strong family dynamics in the construction of parenthood. Slides. In view of this result, it is clear that the assisted reproductive technologies slight artificial insemination with donor itinerary of the infertile African spouse is dependent on suffering, which is explained by anxiety, depressive state, family pressure to perpetuate the lineage, respect of ancestral value, the practice of rite in rituals, the weight of secrecy linked to ART, the failure of loyalty to the spouse, the family and the community, the feeling of guilt, the feeling loss of self-esteem and fear of possible divorce, the relationship with to witchcraft, the belief in evil spirit. Slide. This study shows the place of ethnopsychology in the treatment of infertility in general, in conventional medicine, and specifically in male infertility in Africa. Thank you very much for your kind attention. I really thank